Hi, Derek. How are you doing today?
Doing okay. How are you?
I'm doing pretty good, thank you. My name is Michael. I'm a student physical therapist here working under Dr. Clausen, and he asked me to come in here today, as you told me that you had some knee osteoarthritis, from what I understand, right?
Yeah.
How is your knee doing?
Today it's not too bad, but some days it hurts pretty bad. Like I can hardly walk some days. And it's
Right.
this right knee.
It's your
that's
right
bothering
one?
Me, yeah.
Okay, perfect. So what I'm going to be doing is, what I'm here for is to apply a mode of electrical stimulation called high rate TENS. And what it's going to be doing is to help reduce that pain presently as it's being applied, but it's also in the long run going to help with that pain management as well, all right?
Yeah, that sounds really nice actually.
Perfect, yeah. So the indications, as would be more obvious for this case, would be the pain with the arthritis in the knee. The TENS application is going to be helping to reduce that pain. The contraindications with the situation would be if the patient had a pacemaker, if there was any tissue damage, open lesions, open wounds in that region, right, for this patient right now on his right knee, if there was anything there, if he has any history of thrombosis or any tumors, malignancies, any cancer. If the patient was a female, I would ask if she was pregnant, and as well as any lack of or loss of sensation in that area of his knee with temperature or pain or anything of that sort would be a contraindication as well. So, alrighty, Derek. So, what I'm going to be doing is I'm going to be applying these pads around your knee. These pads are going to be emitting a little bit of an electrical current through them.
Okay.
The current's just going to be focusing on your knee. Like I was saying, it's going to be helping with that pain right there. So for me to apply these on, I'm going to have to place these on your knee. Is that okay if I put them on your knee for you? Okay. I'm just going to move your shorts just a little bit. Sorry if they're cold.
Oh,
A little cold.
I've had colder, but they're a little cold. Yeah.
They're good.
No, thank you.
Alrighty, Derek. So I haven't started this yet, but when we do get going, if at any time you feel any abnormal pain or tingling going up or down your leg, if you're uncomfortable in any way, just let me know and we'll stop it right away and get you sorted out, okay?
Yeah, of course. Sounds good.
Okay. So since we're doing high rate TENS for this particular situation, I'm going to be putting it into biphasic since it's a biphasic pulsed current. I'm going to be putting it into a continuous rate because for pain control, we don't want it to be on and then off. We want it to be a consistent stimulation. And then for time, we'll just keep it at about 10 minutes. Usually we'll be applying it for about that long, if not longer. You could be up to like 20 to 30 minutes depending on the patient. So for this, the rate, minimum is about 50, going up to about 100. So I'll bump this up to, let's say, 80 as a rate. And then the width, we'll put this down to 80 as well, because the range is usually below 100 or 100 or a little bit lower, from about 8 to 100. And then for the intensity, we're just going to be shooting for a sensory level stimulation, because the goal with high rate TENS is to activate or buy into what's called the gate control theory of pain control, which in essence is going to stimulate the A beta fibers and not allow the delta or the C fibers to be stimulated as they're returning up to the spinal cord through the dorsal horn. So, okay, Derek, so as we increase this, I just want you to let me know when you start to feel a little bit of a tingle, okay? And then we'll continue increasing to a strong, tingly kind of a sensation. We just don't want it to be painful, and we don't want any kind of muscle contractions at this point.
Cool. That makes sense to me. Nothing yet.
Nothing yet? Okay. Be careful with your finger in the top right hand corner. Feeling anything yet? Nothing yet?
Oh, feeling a little tingle.
Oh, starting to tingle.
Yeah, started. Very weak tingling.
Okay.
So you said you want it strong, but not like too strong.
Right. We don't want any pain and we don't want any muscles twitching either.
Keep going. That's probably good.
Right there? Okay, perfect. So then we'll start you on that. And for sake of this video, we'll just go for about 30 seconds, but usually we would apply it for at least 10 minutes, 10, 15, 20, up to half hour sometimes, depending on the patient. How's that feeling, Derek? Is that still just a good tingling sensation?
Yeah.
Okay, good.
Yeah, it feels nice. Consider pain relieved, at least for now.
Good. That is the goal. All right, Derek. That was a fast 30 minutes.
It was.
There you go. So I'm just going to take these off quickly so it doesn't hurt you or as much. All right. And from there, we would continue on to the next phase of treatment.